I learned a lot about myself during this period of clinical training on the UC Hospital OBGYN floor. I surprised myself in how much I enjoyed working with infants and mothers, as my previous career as a combat medic and infantry team leader in the Army had neither of these things. However, I also learned that I have a lot of problems that I have to overcome in order to be an effective nurse. My problems during this rotation stemmed from my lack of confidence and experience in the hospital setting. I'm still greatly unsure of my role in medical care unless it is specifically pointed out to me, and this led to a variety of problems that I had in the hospital. My lack of confidence in the clinical setting was something that I struggled with during all 3 days of these clinical rotations. I was afraid to do anything that might possibly violate my scope of practice in any way, and unfortunately this meant that if a nurse wasn't around, I was afraid to do anything related to patient care because I was afraid of doing the wrong thing. This included relatively simple tasks like comfort measures for patients I could easily have done myself, and in one instance I failed to lower a patient's bed after they told me that they didn't want me to, even though she was a preeclamptic mother or represented a fall risk. This lack of confidence was related to my lack of experience in the hospital setting. While I realized that this is difficult to rectify in a short amount of time, it was my greatest weakness and I'll probably remain so for a long time. It led me to make some false assumptions that were problematic for me. In one case, while giving an intramuscular shot to a newborn, I let go of the child's leg while giving the shot, and the child kicked away from me and I almost lost control of the needle. If I had more experience, I would not have been naive enough to think that a baby who just had a needle stuck in their leg would remain calm and unmoving afterwards. Due to this clinical rotation, I was surprised to find that several skills I developed in the Army were still applicable to working in an OBGYN unit within a hospital. The adaptability that I developed to improvise tourniquets in Afghanistan was equally applicable when dealing with unfamiliar situations in the hospital. Thus, after learning how to do newborn in-processing for the first time, I immediately worked to do in-process 5 babies during the second day of the clinical rotation. I wasn't expecting to do all of this myself after only being shown once, but I was able to adapt and overcome my nervousness to do an acceptable job. Another skill from the military I was able to utilize effectively during this rotation was the ability to seek out and absorb information quickly. This skill was developed due to the need for accurate military intelligence, and that's why I speak the Dari language from Afghanistan. I repeatedly sought new information from staff members and computer databases to better understand my patients and their illnesses every day that I was on the OBGYN floor. This allowed me to build a better understanding of one of my patients who had preeclampsia and had recently given birth, so that I could better educate her on the after effects of magnesium sulfate that she was experiencing at that time. Finally, the skill that I developed in the military that helped the most during this time was the ability to relate to others. It's not a very well publicized skill, but it is vital in combating insurgents by winning the hearts and minds of the local people. I was able to use the skill to interact with staff members to learn new skills as well as patients to aid in their treatment. During my second day of the clinical rotation, I helped a nurse with a newborn who was experiencing respiratory distress after being delivered to a mother who immediately afterwards suffered from a massive postpartum bleed and underwent a hysterectomy. The child's father was understandably upset. As I was able to imagine myself in this position, I calmed him down by telling him that his baby could probably recognize his voice because she had heard him while in his wife's uterus, and this allowed him to bond with his child and focus on her rather than panicking because his wife had just lost a massive amount of blood. This also calmed the baby down because she heard a familiar voice after being surrounded by strangers and only meeting her mother for about 30 seconds. I will apply this new knowledge of my strengths and weaknesses to my future rotations and my nursing career by using my strengths to minimize my weaknesses. I will use my adaptability and ability to relate to others to conceal my lack of confidence. While I may continue to lack confidence for a long time, if I can understand what my patients need and adapt myself to those requirements, I'll be able to either gain real confidence or fake it. If there's one thing the military has taught me, it's that the appearance of calm is often more important than the reality of it. Next, I will use my adaptability and information gathering ability to overcome my lack of experience. Experience is gathered not just from living through life events, but from learning from them. If I can maximize the knowledge I gain from occurrences that I participate in during clinical rotations, I can more quickly overcome my lack of experience. To implement this plan, I'll spend at least half an hour out of every day for the next 30 days during this studying the specific pathophysiology and treatment behind the patients I had during this rotation, using the notes I'd taken on them. Concurrently, I will also reflect on how I could provide more effective care should I meet patients with a similar ailment in the future. Therefore, my plan involves study and reflection on the experiences I had with patients during the clinical rotation. Only when I'm a subject matter expert in their disease processes and treatment methods, as well as the side effects of nursing interventions relevant to their treatment, can I truly say that I've learned from the experience of treating them and gain confidence for future clinical rotations and my nursing career.